Our third speaker is Alik Sokolov from RiskLab. So a quick bio, Mr. Sokolov has a professional background in consulting as a machine learning technical lead with Deloitte's Omnia AI group, and venture capital as a research associate in one of Peter Thiel's funds. Mr. Sokolov is also a seasoned AI project leader and educator in machine learning at University of Toronto at the Masters of Mathematical Finance program, and as well as other workshops and classes around the world. And he is also a PhD candidate at the University of Toronto, studying applications of machine learning and quantitative finance, has several publications in finance, AI, and responsible investing. Please take it away.
Thank you. Hi, everyone. So this paper, I think, hopefully nicely rounds the previous two in that this is more focused on how these different types of forecasting models can be applied, or really how can we create a forecast agnostic approach to then take the predictions we're making about the spread of the disease under different scenarios and figure out what the optimal path are for us to take, what the optimal path really of governance actions are for us to take. We completed this research, this preprint, pretty early in the pandemic in 2020, but I think the findings and the approaches are still very much relevant today. So if we consider a pandemic like the COVID pandemic, we have these different sets of mitigation strategies we can undertake, like physical distancing, wearing masks, doing contact tracing, etc. All of these different mitigation strategies, of course, have an impact on the spread of the disease, but they also have an impact on other social factors, right? Like mental health of the population and levels of debt and macroeconomic risks and of unemployment. And the question we asked ourselves is, how can we optimize all of this together? So we have these multiple actions, we have these multiple impacts. Can we unify this and build what we would call an integrative model to understand what the optimal series of steps is for us to take to reach some sort of optimal, or let's say cost minimizing outcome? So in order to do this, we of course had to take a somewhat simplified view, but we try to focus on the actions that were most immediate at the time and social impacts that were most immediate and measurable. So in the case of mitigation strategies, we looked at closing office buildings, limiting mass gatherings, implementing mask mandates, closing schools and research institutions, as well as closing retail and restaurants, right? So as you well remember, these were all the kind of mitigation steps that we were considering at the beginning of the pandemic, of course, before the vaccines. And then, of course, there is the social impact of the actual COVID-19 caseload, which leads to death and leads to loss of quality of life years for people who do get sick and recover, and unemployment rate. So that was our way of looking at overall economic impacts to take a single metric. We combine these together into a single cost function. Now, here we need to find a kind of exchange rate so that we can convert the economic impact and the health impact in the same units. And actually what we used is some research from, is some external research that essentially converts quality of life years, or QALYs. This is commonly used in health research as a way to understand, okay, how, what is the value of mitigating a particular disease, for example. And of course, there's an economic translation there. If we were to use all of our economic resources to try to maximize quality of life years in the population, there would be an immediate effect that we could have with the dollars we spent, right? So we basically took this research and used that to create this as a unified loss function using this kind of conversion rate for quality of life years into unemployment rate. Now, as we do this, the question becomes, given these mitigation steps, we can translate these mitigation steps into economic impacts by doing some high level analysis, right? This becomes almost a financial economic exercise, right? So if we close schools, there is a particular number of, there's a drop in economic activity because of that, right? People stop consuming, we have a impact on the economy, our unemployment rate goes up, right? Similarly, of course, like if we close office buildings or if we shut down other businesses, there are direct economic impacts there. As we do that, as we incur these direct economic impacts, we are also slowing the spread of the disease. And in the case of 2020, basically buying ourselves time to for the vaccines to arrive. So the other side of this equation is actual disease spread. So I will, in the interest of time, I'll go over this part quickly, but essentially we just used at the time a state of the art SAR model in order to understand how to project forward the spread of the disease under these different mitigating conditions. Because, and actually SAR models make this quite simple to do this kind of analysis, fortunately, because for every one of these mitigation steps, as we estimate economic impact, we can also estimate what is the average number of contacts we're reducing, or in the case of wearing masks, what are the reduction in transmission rate overall in the population. And these very nicely correspond to hyperparameters that we already estimate when we calculate these SAR models. On the slide, you can see some of the economic assumptions we used for the estimate of the economic impact of these mitigation strategies, as well as the impact on spread. And on the slide, you can see a little bit of detail. So where we took the quote unquote conversion rates was from Hall. You'll see the citation at the end. The specific conversion rate from the specific conversion rate was based on the fact that based on surveys, people are willing to trade 6 years of consumption for a year of life expectancy, which is kind of morbid, but I guess this is how we collectively think about these things, right? And based on that, we sort of use this to understand, okay, what is that conversion from a year of unemployment, right, which we can equate then back to years of consumption down to a year of life expectancy lost. And this actually allows us to take it all the way back to finance and what we do at RiskLab at the University of Toronto. We do quantitative finance research, and one of the things very familiar to us is this type of visualization. We call it the efficient frontier. In the world of finance, the efficient frontier is basically constructed around the fact that there are risk-return trade-offs between different types of strategies. And in general, as your return goes up, your risk also goes up. But that being said, there are strategies that are better than others in terms of the risk-return trade-off. They can keeping risk the same. You can sometimes improve return, or keeping return the same, you can sometimes decrease risk. The strategies that can't be improved in that way are along the efficient frontier. So in the same exact way, we had an efficient frontier of strategies that we found using randomized simulation, essentially kind of a Monte Carlo search, where we couldn't improve for a particular strategy either the health impacts without compromising the economic side, or we couldn't improve the economic side without compromising the health impacts. And you see this efficient frontier curve for these mitigation strategies on this chart. What we then would do is we would take samplings of some of these efficient strategies and present them in our paper. And I'll show you how intuitive the findings are. So at the beginning of the pandemic, if you were really following what's going on with mitigation strategies around the world, you probably didn't need our paper to tell you that a wiser approach, assuming we thought that vaccines were coming at a certain point, was to lock down hard and fast early, and then open up, giving some 6 or so months before we thought vaccines would be arriving. And in fact, given the time horizon that we were taking, the 1.5 year time horizon, you can see exactly this. The strategies that were optimal along this efficient frontier were prioritizing harsher lockdowns earlier. And by the way, interestingly, so the lockdowns start sort of medium harsh, then get harsher, and then get relaxed significantly as we get closer to, in our case, this horizon of where we thought the vaccines would arrive. Of course, the health impacts and the economic impacts are kind of symmetric, right? You have this constant trade-off, but of course the timing also matters on a fixed time horizon. The earlier you open up, the longer you incur the cost of doing that because of the exponential nature of spread. And then here on the bottom, you can see actually the different sequencing of mitigation strategies our algorithm recommended. You see that mask mandates being in place is recommended basically the whole time, which again, given some easy cost assumptions, is pretty intuitive because the cost of wearing masks in our model is very low and the mitigating factor is quite high. And all of the other mitigating factors are kind of front loaded, right? And then we gradually open up as we get closer to the time horizon. We advocated for this approach really as a policymaking tool, right? So for policymakers to take a look at these kinds of models, taking all the great work that is done in terms of forecasting and combining it with some economic analysis work to understand what are the trade-offs that we can make earlier in the pandemic, and how do we optimize over some reasonable time horizon with some reasonably long-term planning and getting mathematical and quantitative about these models. So thank you. Thank you for listening. I think I'll leave a couple of minutes for any questions.
Well, thank you very much, Alik. This is a great presentation, fantastic work.